So I'll love to introduce Dr. Brian Walker, who is not only a medical doctor but also the first Legalise Cannabis Member of Parliament, along with his colleague Sophia in WA, and I think it was in May 21. So you really started the dominoes falling in terms of other people being elected. And Brian is joined by Dr. Karen Hitchcock, who's joined us from Melbourne. Karen was one of the first, if not the first, authorised prescribers. One of the first. So she's had a lot of experience now as being an authorised prescriber of medical cannabis. And then Dr. John Teh also has been very busy since 2016 when medical cannabis was made legal federally, and he has running a really interesting practice called Plant Med ever since then, and a Queensland experience. So we've got WA, Victoria and Queensland. And then also very much welcome to Mirembe for coming to really share about your experience as a patient and possibly, trying other sort of ways to treat conditions that weren't successful, and how perhaps cannabis has helped you as well. And thank you to Mandy, who's Mirembe's mentor. Mandy also might have some things to share as we go along in terms of her use of cannabis and how it might have been helping you in your life as well. So, and we'll open up to questions after you guys have a bit of a blag. So over to you, Brian. Thank you.
Thank you for that very much. And welcome all as well. Now, I have a lot of time for those who are abused by the medical system and are finding that cannabis is actually a cure. So I'm actually a rebel, but I follow in the footsteps of those who are rebels before me. One of the things that I notice as a doctor is that people come to me. Now, usually you're managing disease to death. When we're managing with cannabis, people are coming in and saying, you have transformed me, you have given me life again. So you've given me, actually, as a doctor, joy, because I can now think, what a wonderful thing has happened. So we're having a transformation in medicine, but it's being opposed by people who think this is a dangerous drug. And so this will be open to the public. If you have any questions before we finish our part, please do. But I'd like very much to hear from you, Mirembe. Tell me, what's your experience?
That's a very broad question. My experience specifically with medicinal cannabis. Okay, so I've been using medicinal cannabis now for 3 years, but it has not been an easy journey for me to actually get here to where you see me today. As a woman of colour, one of the main barriers for me was being a woman of colour because no one actually believed that I was in pain. I have Ehlers-Danlos syndrome. That's a connective tissue disorder, so it means that my joints are very, very painful, and when I was at my worst, it felt like my spine was on fire. Eventually, after being recommended medicinal cannabis by my pain specialist at John Flynn, and I found the suggestion at first to be quite confronting because I come from an academic background where I was not an ideal candidate for medicinal cannabis because I have a predisposition towards a variation of mental health disorders such as bipolar, CPTSD, depression and anxiety. So I was told that I would trigger my PTSD by using medicinal cannabis. It took me a while to figure out what would work for me when it came to medicinal cannabis. It's been a very long journey, a very challenging journey, but I must say it has been absolutely life-changing. And I would never go back to what one of my doctors called a party pack, and that was ketamine. I've also been prescribed morphine, OxyContin, Endone and Valium. So there was times when I couldn't talk, I was barely conscious, I would nod off during conversations, and now look at me. This is thanks to medicinal cannabis. But also an amazing supportive team. And I think one of the most important things that practitioners need to take on board is when they have patients, try being empathic, practicing kindness, and being compassionate. Because it makes such a fucking difference. Thank you.
John, how do you respond to that?
Well, unfortunately, it is a very common scenario, and the party pack is a normal set of drugs that we give to people in chronic pain. But unfortunately, there's a lot of side effects that come along with those drugs. So in Australia, we have a massive opiate problem, and someone's coming to us with pain, and the go-to is opiates these days for most doctors, although it's been pulled back a little from legislation and doctors getting a tap on the wrist saying, hey, look, there's a lot of people dying and we're watching what you're prescribing. So, I mean, that bounces me to another topic where last year, the year before when this happened, there was a lot of patients coming to Plant Med clinics. So I have a clinic in Brisbane. We specialise in medicinal cannabis, where people were coming in pretty much in acute withdrawal, where they've gone to their GP and they've had these pain medicines removed. And these are addictive medications, so we start people on these medications and then we're happy to pull them off with no warning and no tailing and leave them in worse distress than they started. So that's a really big problem. But I think, you know, it is right that we listen to people, and it's important that we have compassion as doctors and look at alternatives. So the majority of people that come in on the party pack of drugs don't want to be on those medications, and they turn you off. All of those drugs are basically designed just to turn your brain down. And zombie is the word that comes to a lot of patients' mind. I feel like a bit of a zombie. I can't talk to anyone. I can't communicate. My pain's okay, but I just have no zest for life anymore. I don't want to do anything. I'm just not happy. So I've definitely seen a lot of PTSD. And PTSD is not just from war, okay? You can have PTSD from anything. You can have PTSD from a car accident. You can have PTSD from abuse at the hands of another, physically or mentally, or financially, you know. So PTSD is a fear reaction that occurs because of experiences in your life. Combine that with a connective tissue disorder like Ehlers-Danlos, and you've got a really combination for severe anxiety, severe pain. And if no one's listening to you, you know, that's a situation where people can take their own life into their own hands. And we have definitely got a veteran suicide rate in this country that is not being looked at. So I think it's really important that now we have a medicine which is able to be substituted in here with a lot less harm, that we use that. And so that's part of all of our jobs here as medical practitioners. And I think when you are treating people with cannabis, it's the same as any other medication. You have to look at all the aspects that are causing that person problem, what other drugs they're taking, and then add in cannabis, and then take away the other drugs that we may not need anymore. And I've personally seen amazing results, you know, a lot of great results on PTSD and anxiety. And there's, we haven't got enough time today, but there's a whole process called fear extinction. So we turn off the fear that's associated with the memory, and then it's just a bad memory. And that's one of the amazing things that cannabis has the ability to do, used well. So, yep, thank you for having the courage to come up on stage and share your experience, because it's really important.
Now, you might think that with this wonderful preparation, the people will be falling over themselves to get to be able to prescribe this. But only 2% of doctors actually prescribe cannabis. It's actually quite a big thing for us. What's your story, Karen?
Yeah, I ran away from a public hospital as soon as cannabis became legal to prescribe, because I was one of the physicians of last resort at the hospital, where all the subspecialists would send their patients to me after they'd been seen by everyone and were on a handful of medications that were making them feel horrible. And so there has been a lot of resistance from the medical community, a lot of fear. I would think the vast majority of doctors haven't even smoked a joint in their life, and so they really don't have any idea. I've been lucky in that as a specialist, I have a good relationship with a lot of the physicians that I worked with, and they trust me, and so they're prepared to send their patients to me, and that's happening more and more. But there is a huge amount of resistance from the medical community due to ignorance, really.
One of the things, I led a select committee on cannabis in terms of barriers, and we travelled quite a bit in southwest of our state in WA, and also in Czech Republic, Germany and Israel. And the one word came across very frequently. Every single one said this: we need more education. Everyone said that. And one of the things that we as doctors don't get taught about is the endocannabinoid system. We've known that since 1996. Do we have any thoughts here about how the endocannabinoid system can transform our understanding of wellness?
I've got a lot of thoughts about that. So, this is not a lecture, but just so everyone knows, in our bodies we have an endocannabinoid system. It's been there from birth until death, and we've evolved with cannabis in this planet. So for the last 50, 60,000 years, we know that cannabis has been intimately involved with our diet, as a medicine, as a sacrament, as a recreation. And in our bodies we have a system which we secrete molecules which are the same shape, roughly, as the THC and the CBD, which we use as a medicine. So the main aim of this system is just to bring balance back into our bodies, and it works as the head coordinator or thermostat for all of our systems. So inflammation, pain relief, inflammatory diseases of the mind, mental diseases, gastrointestinal upsets, literally everything, reproductive system. So because of the prohibition that has been happening and is slowly changing, we've had a deficit of cannabinoids into our body, and there's actually a concept of addiction medicine or just medicine of our bodies, how our bodies works, that when we add something into our bodies all the time, especially if it stimulates the addiction centres in our brain, it's a way of us learning, and we keep putting something into our bodies. It could be anything, it could be opiates, it could be cannabis, it could be any medication at all. And our body learns, hey, this is important for this body, this person, and we need to make sure that we can utilise it well, and we actually change what happens in our bodies. So by consistently inputting cannabis into our bodies as a medicine, our body changes in response to that. And it allows itself to be more modulated by the external cannabis and helps us, in a very broad sense, gain that balance again. And that balance will give us freedom from disease. So if we support this endocannabinoid system, which we all have, we can certainly make our bodies better, make our lives better, make our health better, and then ultimately make our community better, as we're all better humans. So I could talk for hours on this one, but it's very important that we know the system's in there, and that every time you're using cannabis, you are stimulating that system, and that even if you're not using cannabis, you still have cannabinoids in your body, which are helping to direct your health. So it's this deficit which is a problem, I think, over the last 100 or so years, Brian.
Thank you for that. I must actually listen more to you, actually, John. Mandy, I was wondering, having heard about what you know about as a mentor here and the medical side here, can you riff a bit on where you see medicinal cannabis and the barriers and how it's helping and how we have troubles in society? Go for it.
Okay, thanks, Dr. Brian, Dr. Nolan. I was actually doing a joke here last night, because we're talking about medical cannabis, but I don't use any other substances now, except occasionally cannabis, and I use it for cleaning, and it's very effective. Without cannabis, I'm unable to clean the house. So I would like to be an advocate for some legalisation for cleaning weed. Just letting you know, it's a spectrum. So what I actually do see, though, and in conversations, particularly around looking around, having worked with Mirembe and having seen over, the last 3 years, how, and she can tell you more about that, how impactful it's been. The difference it makes when GPs have access to information, but take the time to do the training. I feel one of the greatest barriers is around education, but it's also around willingness to actually engage in that kind of education, because it's going to change the way you deliver practice. And you have to be prepared. I think the clinical model isn't always the best and most responsive model to deliver the kind of care that is required. Those 20-minute visits that come back, that you're going to have some innovation around the way, health is delivered. And I think it's not just about, when we start talking about innovating, which I love about cannabis, it's why we have this festival, because cannabis comes with culture. It comes with systemic change. It's somehow part of a peace movement. It's part of disrupting systems. So it's not just even about marijuana and cannabis and health. It's about changing the way we do everything. And I think having, really looking at holistic models, really looking at how we can change them to make patient experience the best. From the stories that when Mirembe and I have worked together on some of her keynotes, and the stories that Mirembe has told me in confidence, but obviously not going to say it. I'm going to say it now, don't worry. No, about the experience of a patient who is constantly having to advocate for their own treatment, who is then traumatised by the system, because I think sometimes people have post-traumatic stress, not just from their condition, but from the treatment from the system.
Oh, 100%. That's iatrogenics, the word for that. Yeah, you can get disease caused by medicine.
Yeah, exactly. And I think, Mirembe's story, which is so courageous, is her persistence in those adverse situations. All she was doing is looking for treatment that works. And, and as a patient, that's your right. You shouldn't have to advocate so hard for that to happen, because you are pushing up against an adversarial system that makes lots of value judgments. So I'm a great believer the barrier is a broken system that is set up around Medicare billing, not around patient experience. It needs to be a lot more flexible, a lot more agile, and of course the laws need to change. But, Mirembe has a story, sorry Brian, which I'd love her to share, which is how she persisted, because it's been life-changing for her, how she persisted, because it didn't work straight away for her. She had to persist. Do you mind if I throw to Mirembe?
Well, by all means. And as you're doing that, could I ask Mirembe, do you find that doctors listen to you?
No. No, the doctors didn't believe me. It was 2019 when I was in excruciating pain. And I was actually sectioned twice because people thought that I was drug seeking. So I was accused of being a drug seeker numerous times. And I actually was seeking drugs, but only because I wanted to stop the pain. But because I had a history of substance abuse, and I'm dark-skinned, it was really, even thinking back on that period now, what did you call when the system that you're looking for to help you actually cause more trauma?
Iatrogenic is a word which means disease caused by the medical system.
Yeah, well, I have that too. Definitely. So now, because I have PTSD, when I'm traumatised, I can't think properly, so I need to ask what the question was.
Well, Mandy was going to ask you some details. What was that about Mandy you wanted?
Oh, pardon what?
See, one of the side effects of cannabis is memory loss.
It's the cleaning weed, Brian. The cleaning weed. It's got to
Should see a house. That's beautiful.
So it was really for Mirembe. We were talking about doctor experience, and then I was wanting you to share a little bit of experience of how your life changed, and because the first time, when you told me when you started using medical cannabis, and it actually ended up in a situation.
Oh, I was sectioned. So I was very unwell. I've been very unwell for a very long time, most of my life, unfortunately. But so I was getting really bad anxiety, and I was being prescribed at that time medicinal cannabis in a form of oil, so THC oil and then CBD oil. But I was so stressed. I actually drank the THC, and Mandy calls it a green out. But actually, I induced psychosis, so I was sectioned. So it has not been an easy journey for me to find out what works for me. But the prescribed medicinal cannabis I take now is in capsule form, and I find that is very good for me because I can control how much I take, and I can increase the amount. So, for example, 2 capsules of the CBD and THC capsule if I'm getting a lot of pain, because CBD in particular helps my pain. The THC helps my anxiety and my depression. That's what works for me. So the capsules are amazing for me. I take more if I need to and less when I don't need to. And also I find that it's more socially acceptable if I'm out to be taking a capsule rather than sitting there dropping oil into my mouth. People are like, what are you doing? I remember when I was actually volunteering somewhere and someone said to me, oh, you must be careful with that stuff, people might talk. So that's the kind of stigma that's attached to what makes me, what has changed my life. I'm supposed to hide it? No, I'm going to talk about it and hopefully change the world.
Karen. No, you had a contribution to make there as well, didn't you?
Well, first, can I just say it's completely heartbreaking and shameful for the medical community that to hear patients say things like, the doctors didn't believe me. Like, what are you trying to convince them about your subjective experience? And I hear that in my clinic all the time. People just start crying. And I think that we do need to change the system. I am lucky enough to have a medical practice, and I call it slow medicine, where I have an hour with my patients and just shut up. I used to give a talk to the junior doctors at the big city hospital and tell them that the most important skill that they could learn was just to shut their mouth and just listen to a patient's story slowly and not get into this thing about believing. Like, how can you prove that you have pain? You can't prove unless you have an x-ray with a broken bone, and then the doctor will believe you.
Do you see any difference actually between medicinal cannabis and recreational cannabis?
I think it's really difficult in the setting of prohibition to separate the two. So, I mean, I think there is a difference, and the difference is that when you go to a doctor, I mean, in prohibition, sometimes you'll go to a doctor to get a legal source of cannabis, and that's fine because you don't want the police harassing you. But if we just put that aside for a moment, the difference between recreational use and medical use is that if a patient comes to me as a doctor, they're not just coming for the drug. I mean, one of the big problems in medicine has become that a doctor is just a provider of a prescription. So if a patient comes to me, they're coming seeking healing or wellness in some way, and that is different from just, you know, going to a dealer or growing your own or whatever. It's a relationship that the patient is requesting.
I'm going to actually break a rule here, and as the facilitator, I should put in my 2 cents worth, because so often people come to me and say, you're the first doctor who's ever listened to me, and I find that tragic. But I'm also here with the time there. I'm taking 45 minutes or an hour for patients. Why? Well, because people are coming in because they're not well. Why are you not well? Chronic disease, most of it's going to be gut-related, I would think. What about the psychosocial issues going on there? What about taking into account the thyroid? Issues there with hormone balance and things which have been ignored by doctors because, well, everything's within the range of normal, therefore you must be psychiatrically ill, go and see a psychologist. And I find that people come to me as a last resort and finding, hang about, there's someone who actually cares. And that is something we need to bring into medicine, I would think. John, any thoughts on that?
Well, it's interesting because my initial consult's 1 hour as well. And we do that on purpose in the clinic, and I train my doctors with compassion and knowledge, similar to Karen, and it's really, really important to do that, to spend that time, and I think that's the difference. A 15-minute slot's not enough with a GP. It's not enough with anyone to get any sort of conversation happening. So to take that time and listen and find out the problems, and the human is a whole body of not just parts, but things that are making up their illness, and they all need to be taken into consideration. So yeah, time is important.
Now, what can we do wrong with medical cannabis? What kind of things should we not be using cannabis for?
Acute psychosis is a really big one. I have 2 contraindications. One is unstable angina and THC, because you can, if you've got a heart that's so bad that it's often causing angina and you need to use a spray to stop that, if you use THC, you increase your heart rate, you can perhaps have an infarct or a heart attack. So that's a safety feature. And the other one is to take a lot of care with, though it's not a complete contraindication, is psychotic illness. So schizophrenia, bipolar, anyone that has got tendency to, or has had, or currently does have a psychotic illness, THC can exacerbate underlying conditions and make them worse. So it's very important that you balance them with CBD. It's not to say you can't use THC, but I'm very careful at the start to make sure I don't worsen something for someone. But that's probably the only two contraindications I have.
There is emerging evidence with CBD as an antipsychotic, and I work with a couple of psychiatrists and have had success with CBD only.
Yeah, CBD is very important in that situation, yeah.
Is anyone here looking at the context of CBD as an antiviral for managing, for example, COVID?
I actually, I watched something the other night on YouTube. I can't remember the doctor's name, but he's quite famous for going through studies. That's the one, yeah, and I'm sorry for being a nerd and watching studies in my pastime. But he did a great overview of 3 really recent studies. One was based on a cell line, so they took the cells of a human lung and tested it with CBD. And then they also had one which was a mouse model, and they also then took a model of humans that had epilepsy and obviously taking high doses of CBD, and correlated lots of things to do with viral load and how CBD is antiviral. And it turns out CBD has massive potential as antiviral. In the study, it was 98% pure CBD, so very little or no THC was involved in the mix. And when THC was involved in the mix, it seems like the antiviral effects were lower. I think it'd be really interesting if we could have a look at if we could get the statistics on all the patients in Australia that are using CBD now and see how much percentage of those group had COVID. But there's very, very strong evidence emerging for antiviral qualities of CBD. Very relevant in today's society.
I don't know if you can tell, but up here the doctors are excited about what's going on because we have a potential here for altering the wellness in our society. And I don't know about anyone else here, but I certainly feel we've got to move this forward because people are suffering and people are dying because we haven't equal access to this wonderful, healthy, healing herb. But now can I turn this over to the audience here? Are there any questions among the audience for us here?
Here comes the mic.
Oh, just wait for the mic, please.
I'm so glad that I missed so many thousands.
Is the microphone on?
Yeah. Oh, just put it near your mouth.
Okay. Amidst all the thousands of doctors here, I've got 3 doctors who are willing to prescribe cannabis because my experience is with palliative patients, they only give 0.5. And that's a frustration. How can you, and then they give that opiate on that 0.5. It's very frustrating. And also very expensive, and that's where the availability of medicinal cannabis is really, unfortunately, it want to make me cry because it's so expensive that the average person can't have access. That's one, from my own experience. The other one is, does it help with people who have ADHD? Because there's a lot of emergence of people having ADHD, which is, that's what I need to ask.
Yeah, in terms of ADHD, for certain, yes. I have a lot of children and adults who I treat for autism and ADHD and OCD and Tourette's and all that spectrum of diseases. So usually a CBD dominant medication is what I'll choose, though depending on what else is happening, I may add in some more THC, depending on what they require, if there's any other problems with them or how it works with that patient. So ADHD, yeah, certainly something which can be treated with cannabis. And in terms of cost, depends how much you need to use. So I think, on average in my clinic, it'd be somewhere between maybe $150 and $250 a month. So it works out to be a cup of coffee a day for most people. So if you've got a low dosing requirement, it's basic things like pain or just a little of anxiety, say, and that's it, or some sleep issues, you're not going to need massive dosing. So I think the pricing issue can be a little bit convoluted. However, if you are taking, say, CBD as a mainstay of your treatment for your epilepsy, you might be dosing in the region of 200 to 800 milligrams per day or slightly more, even if you've got the money. And that can be very expensive. So that can end up being in the region of, $12,000 to $16,000 a year. So cost is an issue, but certainly I think cost is certainly equilibrating. And the difference in cost, I think it's still cheaper here to go to the hemp embassy and pick up your medicines. I think it's slightly cheaper, but not significantly anymore. I think parity is really happening. And the advantage of the medical system is that consistency, very consistent medication. We know there's no other contaminants because everything has to be tested, so there's no heavy metals, there's no fungus, there's no bacteria in your medicine that you're ingesting. So cost is an issue, I agree. I would love the government to pay for it, as I know everyone else in this stage would, and that's why we've got people like Dr. Brian in Parliament advocating for us. And hopefully the government does pay for this medicine like it does with everything else. But if you were to go to your pharmacist and not get the subsidies that the Medicare provides for your medicine, you'd probably have quite a shock at what the actual cost of those medicines are, and it's often more expensive than medicinal cannabis. For instance, a treatment of chemotherapy can be $100,000 to $150,000 per year. That's something that we don't pay out of pocket, obviously. So when we take those comparisons, I think cannabis medicine is probably not that expensive.
DVA, spread the word, the Department of Veteran Affairs will now pretty easily fund cannabis. I have a lot of veteran patients that are now getting it funded, and obviously the best scenario would be that you could just legally grow some plants and it's free. That would be the best. One other really silly thing is that CBD formulations without detectable THC are about twice the price of CBD formulations with small 1, 2, 3 milligrams per mil of THC, and it's just the driving laws that stop us being able to prescribe the far cheaper CBDs. But if you're just on a little dose of THC oil every night for insomnia, it would cost about $100 every 3 months. So there are some conditions and some ways of dosing cannabis that are not very expensive if you still need to be provided by the pharmaceutical industry, which is where we're at legally at the moment, unfortunately.
Any comments here or a question down there?
Yeah, look, I take CBD every night to help me sleep, right? And I've been sitting with people that have had COVID, and I haven't had COVID.
Point proven.
So, but 6 years ago, I had liver cancer, and I used the Rick Simpson method. I boiled down some heads in a rice cooker, and I used 28 drops a night. Then I went to the PA hospital in Brisbane, and the head surgeon up there said it's shrinking. So I've had the all clear for 6 years now.
Congratulations.
So I just thought I'd let you know that.
That's an amazing story. Any other questions out there?
Yes, we've got another one up the back. Microphone's on its way.
I'd just like to ask, on behalf of my younger brother, who is a chronic pain sufferer, is there any evidence for the effectiveness of someone that suffers from Sherman's disease and has gone down this path of opiates, and all of a sudden they've been withdrawn, and the family is beside themselves trying to find some sort of help? Is there any evidence for effectiveness for chronic pain?
Well, you're asking a question there which I hear on a regular basis.
The main, if we're just talking medical literature, randomised control trial or big cohort studies, the best evidence for medicinal cannabis for pain is that it makes you feel better. So it's not a general anaesthetic. It doesn't make you feel nothing, but cannabis makes people feel better about, no matter what their complaint is. Weed makes you feel better.
On a more like anatomical point of view, yes, there is a lot of evidence, and one of the main ways that cannabis works, THC is the main pain releasing or relieving or nociceptive pain relieving part of the cannabis plant, and there's a little bit in our spine called posterior aqueductal grey matter. It's just a little section in the back of our spine, and there's a neuron that goes across there, and then normally it's turned off, and when it's turned on, it turns on the pain suppression pathway. And guess what receptors are actually on that neuron? Well, one of them is an opiate receptor. There's a couple of others, and another one is a cannabinoid receptor. So when opiates or cannabinoids attach to this part, or this little interneuron, it turns on the pain suppression pathway. So that will turn down your perception of pain. In your mind as well, your perception of pain is reduced. So a very common answer, a comment pain patients have is like, well, the pain's still there. I know it's still there, but it's turned down to like a 2. It used to be like a 9 and I couldn't hear myself think and I couldn't concentrate enough to brush my teeth. But now I can get on with my day. The source of the pain's still there, so it's not going to fix the source of the pain. Well, it may help in an anti-inflammatory sense, but it certainly does turn down the amount of pain that you feel, that you perceive. And that's the most common thing we're using cannabis medicines for in Australia is pain relief.
Karen.
The International Society of Pain Medicine defines pain as a sensation and an emotion. And I think, look, in Western medicine, we're just hopeless when it comes to treating the human subject. We forget the emotion, we forget psychology, we forget everything, and we're just, thinking about the body. And I think that cannabis, any effective painkiller, has an emotional component to it. So opiates make people feel better emotionally. Cannabis does as well. And so cannabis is great in that it harnesses, both the emotional and the physical side of pain.
Mirembe.
I think I am actually great evidence that medicinal cannabis works very well for pain. My pain was when I was at Gold Coast Private Hospital in 2019. I remember having to have morphine injections every 4 hours. This is on top of, I can't even remember what else I was on. And I remember them thinking they had to increase it to fentanyl. I couldn't walk. I was asleep most of the time because of the morphine. I had to use a wheelchair. And so I've come from that to someone who can walk freely now, as you see me, and talking to you, being able to have a conversation and not falling asleep. That's a bonus, actually. And I've been like this now for 3 years, and I haven't tried to kill myself in the last 3 years. I have made more attempts on my life than I can remember. So that's a significant improvement. So when we talk about it not just being about pain and it also being about emotion, 100%. Medicinal cannabis works for me, but this is in combination with pharmaceutical medications for my bipolar, and also a holistic approach. So my treating practitioners have the belief of taking a holistic approach. So we're looking at the mind and the body and the emotions and the psychology behind it, not just popping a pill and thinking, oh, that's going to help me. It doesn't work like that, and I know how unfortunate that is, but it just doesn't. There is no magic bullet. What is required, though, from practitioners today is empathy, kindness, and compassion. I can't say it enough. Everyone on my team has those 3 qualities, and I thank Katonda. That's Ugandan for God, sort of. Anyway, the stuff works. It's great, but you have to use it in combination to a holistic approach. That's my advice.
When I get patients coming to see me with pain, they're often asking me, can I come off the opiates? And I'm saying, well, first of all, cannabis is wonderful, but it's not a universal panacea. It doesn't work for everyone. However, we'll start this, we'll up-titrate, and as you get an effect, we can begin to think about reducing your other medication. So there's a process there. What we're actually now saying is there's another ingredient here. It can be very, very useful. We'll see how it works for yourself. And generally, I'm finding excellent outcomes. People can come off their opiates or reduce them. So it's not a one or the other. It's a combination of what works for you, because what works is really what we need to do.
I think just one comment. There's a synergism that happens between opiates and THC in particular, and we call it the opiate sparing effect because we can get rid of some of your opiates most of the time. So when you add in THC, your opiates become more effective. It means we can reduce them a little bit, or a lot, or completely get rid of them. And I think that's such an important thing with our opiate problem in Australia right now. If we can just reduce everyone by 10%, that's probably 10% less deaths we're going to get. So I don't know the exact figures, but it works like that.
Any other questions? Is everybody happy?
I was just going to ask about, the entourage effect. I know there's been a lot of talk about THC and CBD and so on, and the importance of not just those 2, but a lot of other cannabinoids as well in terms of therapy.
Any thoughts on this?
Sure. So the entourage effect refers to the fact that in the cannabis plant there's not just THC and CBD. there's over 144 so far discovered minor cannabinoids, and they've all got different names like CBG and CBN and a variety of names. Not only that, there's a range of terpenes. There are molecules that give cannabis their nice smell and aroma, and those terpenes are also active in our bodies as well, and they work with the THC and CBD. So if you take an isolated THC or an isolated CBD, generally you need to have a lot more volume or weight of those medicines to get a similar effect as if you have a full spectrum medicine. And it's what Karen was referring to before in terms of the CBD oils with a little bit of THC or the CBD oils with none. The CBD oils with none are generally an isolated CBD crystal that's dissolved in oil and use that as medicine, whereas a full spectrum, or the ones with a little bit of THC, also have those other components that are found naturally in the cannabis plant. And all those different components go to make up the different chemovars or strains of cannabis. So we have your sativa types and your indica types, and within those we have many, many different strains or breeds of cannabis. And all of those have slightly different effects. So it's not all about just have a bit of THC and CBD and you'll be fine. If you have a good cannabis doctor or someone who's experienced with cannabis medicines like you'll find here in Nimbin, then you will be directed towards medicines which may suit your condition a bit better. For instance, I would not give someone a strong sativa flower or any sativa flower if I knew they had a really bad anxiety history, because that's maybe likely to cause more anxiety. Sativas have terpenes which are uplifting in them, and they can energise you and get you moving, but they can also worsen anxiety. What people generally consider medicinal cannabis or cannabis generally is generally indica medications, and they will tend to have different terpene profiles that give them their characteristics. In particular, you'll be looking at terpenes such as myrcene, which is found in hops and mango, caryophyllene, which is found in black pepper and some other minor plants. They'll be more in your indica varieties, and they'll give you that more muscle relaxation, more couch lock effect that you get if you have a heavy indica. Whereas the sativas will be based more on limonene and citrusy smells, pinene, things that I call Norska fresh. When you walk through a pine forest, you feel uplifted. So those are more sativa-based qualities. And of course, with the breeding of cannabis, we can have everything in between those two extremes. And then we can have very high CBD or very high THC, or balanced amounts. So there's a lot more to this than just, hey, have a bit of weed and off you go. When you think about it clinically, you can match medicines to the effects and the symptoms that people have, and that's a good cannabis doctor. I'm all for every doctor in Australia to provide cannabis medicine, and I think there's a good place for all GPs to be able to quickly whack out a 1010 to just about anyone in the country, or a bottle of CBD. But I think that time constraints and the knowledge of those doctors may not be sufficient for some people who need extra special care, and that's when you go to someone who specialises in cannabis, someone who does it every day, if you want that advice.
Now, one of the problems we're facing, because cannabis has been prohibited for so long, is that research has been very limited as well. And what we're now seeing is a fantastic uptick in the amount of doctors interested in providing evidence. I was recently in Israel, and there's one of the research centres there. There's a room about this size here, but three times as high, and it's filled with distillation equipment, filled. And what they're doing is they're extracting the individual cannabinoids and the terpenes and the other ingredients of the cannabis plant to individually test for individual symptoms or individual diagnoses. They're the ones who've come out with a recipe for treating ovarian cancer, 75% THC, 4% CBD and 1% CBG, treating ovarian cancer. Now, this is interesting stuff, but they're also, if we link back into yesterday's talk, Mark Webb with the aromatics and the tremendous improvement we can get in certain symptoms. Remember, terpenes is what makes the plant smell. The aromatics also make plants smell. Do they have medicinal effects? Of course they do. So how do we put these together to work as doctors? Well, the answer is we don't yet know enough, but we're learning it.
Yeah, we just experiment with each patient, or experiment together, really. I mean, it's a very complex plant, and we're very complex creatures. People have different get different effects from the same, if I gave the same indica to two patients, they would have a different response. So really it's just a matter of experimenting at the moment, because there's not going to be giant trials the way there are with blood pressure pills or anything, because you can't patent cannabis. So we're relying on small trials.
I have the impression we could sit here all day and talk. We can also sit here all day and listen, but time has come to a close. So if there are any final question at all out there? One more question?
Yeah, hi. So I know we've talked about oil a lot. So as far as like the prescription of the herb in dry herb vaporizers, what usually is the reason for prescribing that dry herb vaporizer as compared to an oil? Like, what are generally the use cases for both of those?
Well, in Australia, if you just look at the data on how many scripts are being written for what, the number one reasons for being prescribed dry herb at the moment are insomnia and anxiety, according to the TGA data.
I probably look at it a little bit differently. I look at it, what's the result this patient needs to get out of their medicine? So with oils, you get a longer duration of action. So you get like maybe 8 hours per dose. So you can have 2 or 3 doses a day and have a baseline treatment all day. But you may have exacerbations. You might have pain flares. You might have anxiety flares. So you may not use a strong sativa flower for your anxiety, but you might prescribe a balanced flower, a CBD dominant flower for anxiety, or if high THC does make someone calm, prescribe that. And that's because it gets in quicker. The other major difference between flower or dried herb and oils is the level that you get to in your blood. So when you inhale cannabis, it doesn't go past your liver and you get a much larger dose quickly. It can be as much as 10, 20 times more than the same dose orally. If you eat the same dose, it's got to go through your stomach, deal with acid, then go straight to your liver. It starts to get metabolized straight away. So that's the main difference. So usually you will use a combination of oils. I will use a combination of oils as a baseline and a herb for quicker action. And some people have preference. If you've come to me I don't discriminate between recreational and medicinal use. I think people treat themselves medically, recreationally because they haven't been able to treat themselves medically. That's just all there is to it. And also believe that if someone does want to cross over to the medical side of things because they feel more secure, because they're not going to get sent to jail or in trouble for having illegal cannabis, I think that's also a legitimate reason. You're reducing your stress. So if someone comes and they do have a preference for flower, I've got no problem scripting flower, but I will make sure they've got enough CBD on board, usually as an oil because it's cheaper. But if they've really got some intolerance to oil, then you can include CBD as a CBD dominant flower or balanced flower. So once again, it's case to case and person to person.
Could I get a prescription for cleaning weed?
Yeah, that's definitely sativa.
It's just a joke, obviously, Doctor.
No, it's not. And on that wonderful note, I will thank you all. Thank the panel here for all the information given.